Today, we are experiencing an exciting moment for LGBTQ healthcare. From policy changes mandating health plan coverage for transgender-affirming healthcare to new HIV prevention tools and methodologies for better HIV treatment, including the governor's Ending the Epidemic Blueprint, to more inclusive training for medical providers who want to provide affirming medical care for our LGBTQ communities. We have come a long way.
I went to DC, I was managing a nonprofit there, and things were pretty together. I was on top of the world, it seemed, but inside it was like the worst time of my life. And things came to a crash, and I started trying to figure out what to do next, and I had a wonderful mentor step into my life, more like a life coach, and found my way back to New York City. And that's where I found Callen-Lorde again. And Callen-Lorde really saved my life and helped me figure out what my path needed to be from a comprehensive perspective, not just, here, take some HIV medication.
Before Callen-Lorde, LGBTQ-centric healthcare simply did not exist, so we did something about it. Since the days of Stonewall, we have provided a welcoming environment for LGBTQ communities to get quality care, free of judgment, and regardless of ability to pay. We created a place where patients get access to passionate caregivers who are reflective of LGBTQ communities.
I went and got a body cut and changed a little something, and now I feel like I can restart my life. And so I feel like that's really the opportunity I got through Callen-Lorde, was a restart to my life.
Today, nearly 50 years later, Callen-Lorde is the global leader in LGBTQ healthcare. Our efforts don't stop with direct patient care. Callen-Lorde pioneers research, advocates for social change, and educates the medical community to help transform lives, not just for our patients, but for all LGBTQ people around the world.
Ideally, patients should be able to go anywhere to get their care, right? And that's the goal. But unfortunately, that's not really the case just yet. And I think that Callen-Lorde is just holds an incredible place in the community, and people look to Callen-Lorde for guidance to managing their patients, in their own practices.
When I go to Callen-Lorde, I see how they interact with the patient and the employees. All the employees are so wonderful and friendly. So that's how I think that they're excellent, and they take care of the people who need medical treatment.
In 2015, we saw 17,000 unique patients at Callen-Lorde's 2 clinical sites for a total of 100,000 visits. For our uninsured patients, we provided more than $5 million in unreimbursed care. Yet the demand for our services consistently exceeds our capacity, and we have to turn people away at alarming rates.
It's been 14 months of consistent, wonderful, spectacular, understanding care that has taken me from someone who knew where she wanted to go but didn't know how to get there, to someone who is here, out, proud, living authentically, living happily, happier than I've ever been.
On July 1st, Callen-Lorde opened a small clinical site in the South Bronx in partnership with longtime Bronx organization Boom Health. In its first 3 months, Callen-Lorde Bronx provided over 1,200 visits for almost 600 patients, nearly half of whom traveled to the Bronx from other boroughs just to be seen at a Callen-Lorde site. This demand far exceeded our early expectations and shows how much more work needs to be done. Next up will be Callen-Lorde Brooklyn. Beyond our partnerships and identifying new sites in vital neighborhoods, Callen-Lorde continues to be on the cutting edge of LGBTQ research, advocacy, and outreach, constantly working to enact positive change and demonstrating to the world what best-in-class LGBTQ healthcare looks like.
That I could be responsible and take care of myself and not have to necessarily let emotional trauma or baggage stand between me and taking care of myself. And Callen-Lorde kind of really opened that door
In addition to the impact we have on the patients we see within our doors, thousands more across the globe will feel the ripple effect of our publications, resources, and presentations. In the past year alone, we hosted visitors from over 20 countries, people who sought us out because they want Callen-Lordes in their own countries.
I've learned a lot since coming here and just talking, and and after meeting Asa, I just realised there's so many more people back in the UK I need to get to know, and we need to make the investments in the education and training and reconfiguring everything from reception all the way through the service.
In addition, our numerous international presentations and trainings are helping to improve the health and wellness of LGBTQ people and people living with HIV and AIDS worldwide.
Callen-Lorde sees every day that there has been progress for some, but we want progress for all. With your help and generous support, we can continue to build a strong, sustainable organization that will meet our global community's needs for years to come.